A very warm welcome to all of you, and thank you for joining us today. In the current times of COVID-19, innovation and technology is at its best. We are on a rapid learning path, and phone as a multi-purpose platform has become researchers, program managers, and policymakers' paradise for exchange of information. My name is Niranjan Sagoti. I'm the Director of Population Council India. And at Council, we work closely with Dr. Vishnuvardhan Rao, Director, ICMR's National Institute of Medical Statistics. And the Institute of Medical Statistics leads the National Data Quality Forum on behalf of the consortium of institutions. Often referred in short as NDQF, is first of its kind to enable data quality improvement in India, and this webinar series is part of that effort. While researchers and program specialists across the world are extensively using phone to collect, collate, and disseminate information in the current times, there may be concerns on data quality. Considerations for quality checks in phone surveys deserves a deliberation. And this evening, India time, morning and afternoon, or afternoon to the other parts of the world, we are privileged to have a distinguished panel today with us, moderated by Dr. Sunita Krishnan, India country lead for measurement, learning, and evaluation at the Bill and Melinda Gates Foundation to discuss the quality and use of telephone surveys. My role is to introduce Dr. Sunita, who will in turn introduce the panelists and lead the discussion today. Dr. Sunita is a social epidemiologist with over 20 years of experience in policy-oriented research and evaluations. As many of you may know it already, she and her team at Gates Foundation in India plays a critical role to enhance the national data and evaluation ecosystem. We are honored to have her moderate today's discussion. A few housekeeping rules before I hand over this to Dr. Sunita. Participants' audio and video is disabled, but you can share your questions, comments in the question pane on your control panel at any time point during the session. For those joining via their mobile, please use the question mark on the top right corner for typing questions. Your questions will be taken by Dr. Sunita to the panelists. Thank you. With that, Dr. Sunita, over to you.
Thanks so much, Niranjan, and good evening, good morning, good afternoon, wherever you are, and welcome to the latest edition of the NDQF webinar. So in this conversation today, we're going to explore data quality issues related to phone surveys in India in the context of the COVID-19 pandemic. Organizations participating in this panel have implemented surveys on a range of social, economic, and health topics, reached diverse populations and across geographic and cultural contexts in India. Along with the government, civil society groups and researchers have mobilized in response to the pandemic. Data gathering efforts have aimed to generate insights on the immediate crisis, as well as to inform policy and programmatic decisions and implementation. Questions that have been examined include the extent of awareness and understanding of COVID-19 and related precautionary measures, the implications of social distancing and other prevention policies on households' economic, social, and health status, the reach of relief measures, and the potential medium to longer term effects. We've seen a great deal of innovation. Organizations have repurposed pre-existing household panel studies. For example, Population Council, one of the hosts of this webinar, leveraged their work in the states of Bihar and UP, an ongoing longitudinal panel with adolescents. Others have leveraged the use of community radio, and yet others have converted traditional ethnographic research into a digitally enabled process. So over this 90-minute discussion, we're going to explore the experiences of these diverse researchers and civil society groups in implementing mobile phone-based data collection with a focus specifically on data quality. So they won't be describing the results, the findings of their research, but they're going to reflect on what were the factors, drivers of data quality, and how did they innovate to address those issues. During the first 45 minutes, we're going to have a dialogue with a group of researchers who've implemented phone surveys. And during the second 45 minutes, we'll interact with organizations that have used mobile phones in innovative ways to generate insights on program design and implementation. So let me first introduce panel one. Panel one, we're going to look to learn from you about the kinds of data quality issues in phone surveys that you've identified and the ways in which you've addressed them. Panel one includes Shweta Totapalli, who is an associate partner at Dalberg Advisors based in Mumbai and leading Dalberg's gender portfolio in Asia and directing their current work on COVID-19, particularly with a focus on financial entitlements among low-income households. Second will be Krishanu Chakraborty, who leads the Data on Demand team at ID Insight. The team has the aim of making representative information about citizens' preferences, conditions, and behaviors available to decision makers radically faster, cheaper, and with significantly higher quality. So we're going to be keen to learn how they've done that. Third is Tithi Mukhopadhyay. Tithi is Associate Director of Research at JPAL South Asia, where she leads the development of critical infrastructure for randomized evaluations conducted by JPAL affiliates and partners. Fourth will be Shantanu Pramanik, who is a statistician and survey methodologist and senior fellow at the National Council for Applied Economic Research in New Delhi and deputy director of NCAR's National Data Innovation Center. And last, but certainly not least, will be Sumiran Panda. Dr. Panda is a tropical medicine specialist and clinician scientist and director of the Indian Council of Medical Research's National AIDS Research Institute, which is located in Pune. So with no further ado, I want to turn to Shweta, and let's see.
Hi, Sunita,
so my first
can you hear
question
me?
To you.
Yes.
You've implemented a large survey. Yes, I can hear you. So my question to you, Shweta, is you've implemented a really large survey with upwards of 50,000 respondents across 15 states of India and potentially expanding that further. So can you talk about the data quality challenges faced in implementing an extraordinarily large survey in multiple languages and across many diverse populations and on sensitive issues such as the impact of the pandemic?
Sure, happy to, Sunita, and thanks for having me.
Over to you.
Okay, thanks, Sunita. You know, I think when we think about this question of quality, it keeps coming back to this idea of responsibility, right? And then the reason that responsibility really matters to us as an organization right now is that everyone is paying attention to data. Data is scarce, it feels like the world has reset, and phone-based instruments give you a maximum of 15 minutes with respondents. And many of the respondents, especially the ones that we're speaking with, are in extreme conditions of high distress. And so our responsibility to the respondents is even greater. And so as we've been thinking about what does it mean to implement a phone survey during this time, we've tried to be mindful of a few specific things. I think number one is really being hyper purpose driven, right? And what I mean by that is actually around designing a questionnaire that is appropriate for the phone, but also actually gets you to the kinds of insights that you want, right? So in a normal world, we would have been designing questionnaires of, like 200 questions for 45 minutes, where you could get really deep with the respondent. In today's world, the kinds of insights that we're trying to get to are equally demanding, right? What exactly is happening on the ground? What are the bottleneck and transaction failures? And therefore, what should government do requires quite a level of rigor and depth. And so, when it comes to the questionnaire design as a starting point, what we really try to do is think about what's the end state. Can we actually, essentially mock up our deliverable and mock up our narrative? Can we test our questionnaire against that narrative and iterate back and forth to make sure that every single question that we have is going to be used in the way that we need it to be used, and that it will draw exactly the kinds of insights that we need? And that's been kind of the most important thing, actually, in terms of making the most value out of the fact that all you get is 15 minutes. Part of that has required us to do a couple of things in addition to going back and forth between narrative and the actual questionnaire. What we've also had to do is think about how much simpler do we need to be, right? What does it mean to actually ask a respondent set of questions that may otherwise in a normal world that we could get into much more detail with? And actually we've learned that even things like Likert scales you have to use much more simply, right? And you have to just ask it in the fastest, most simple possible way. And as part of that, what we've really been focused on doing is actually trialing questions with respondents before we actually launch the survey. And so what we've been doing is a bunch of ethnographic research in parallel, where our human-centered design team that actually focuses on user research tries to come up with what are the right answer choices, what are simpler ways of asking this question, can we get there? So it really starts with, for us, getting even that questionnaire right. And then when we kind of get to the translations, which is the second part, and this actually matters because we're trying to do this across 15 states, our work across 15 states, we've been really careful about making sure that our translators are really high quality, and that we do it in a fairly rapid way, but without compromising on that overall quality. And from a translation perspective, the tangible and practical thing that we've really been trying to do is make sure that we've minimized the number of iterations once the tool is live, right? So after it's been vetted, basically to say the bar for any changes has to be really high, because otherwise the likelihood of implementing errors in translations later on also goes up. And because we're trying to process data quickly, much faster than in the prior world, we don't have the ability to process those changes in a way that we otherwise could. I think the other area in terms of quality is really around supporting respondents in distress, right? And so one of the things that we've been realizing is that the work only is as good as the responses that we ultimately get, but actually that many respondents are going through quite a difficult time. Many of us who are researching the various topics that we are, which are of national importance, we might be reaching out to the same people and actually might be contributing to their distress. And we had this experience actually where we were on a phone call with a respondent, and the respondent was actually articulating suicidal thoughts. And so we spent 2 hours on the phone with the person, talking to them, trying to help console them and just giving advice, because we had people who had experience doing it. But ultimately what we did was we actually, coming out of that experience, we immediately launched an end piece to our survey where we actually offered a hotline to every single respondent. And so we're doing that going forward with all of our respondents. And this idea of how do we continue to help respondents in distress is one that we continue to grapple with and are going to continue to explore, especially as we get into more sensitive areas such as gender. So I'll pause there for now. I'm sure we'll get into more operational questions as well soon.
Fantastic. Thank you so much. A lot of rich insights around both challenges as well as ways to respond. Moving next to Krishanu. Krishanu, you and the Data on Demand team have been experimenting with phone surveys for some time, and I know that you've developed numerous data quality assurances. Can you tell us a little bit about the mechanisms that you've put into place? Krishanu? You're still on mute? Okay, I think we've lost Krishanu, so I'm going to move on to Tithi. Tithi, I believe you've begun pilot testing a self-administered survey with frontline health workers. Can you tell us a little bit about how you're thinking about and addressing data quality in the context of a self-administered questionnaire?
Sure. Thanks, Anita. Can you hear me okay?
Yes, I can.
Great. All right. So I think we have started this very, very ambitious survey, which is working with the frontline health workers and collecting a massive symptoms panel from them. And what we realized very early on, exactly what Shweta said, in these kinds of situations where the entire community is dealing with lower social cooperations and we are dealing with lower response rates in general, that's something that comes as a given whenever you want to transition from in-person surveys to phone surveys, but it seems much higher right now. So I think the responsibility on all of us as researchers and implementing organizations is to make it simpler for our respondents to provide the kind of data that is going to allow us to make decisions on the go. So quality as well as responsibility are pretty much at the forefront. So we have tried to, I would say exactly how you put it, we've tried to pilot a few strategies. And what we found was we've basically gone through a lot of options that were available to us. One, of course, was the most straightforward one, that you collect a number of, a list of phone numbers of the frontline health workers, you put your phone survey teams in place. But what happens, what are the options available to us when we need to do this at a high frequency level? It's not going to be the symptoms keep on changing, the picture keeps on changing related to COVID-19 every passing day. So we need to collect high frequency data, but calling up people every 2 days, 3 days is one, an expensive exercise. Second, it increases people's distress, especially frontline health workers who are going out into the field, maybe at times without PPE, and facing, a lot of issues of whether it's violence or stigma. So we decided to play around with a few options associated with self-administered surveys. So one option was, and we spoke a lot to our technology partners like Survey CTO. We are working very closely with Exotel right now, but these two organizations sort of helped us to try and understand how we can, sort of figure out plugins that can allow self-administered surveys to gain a higher rate of response. So we tried everything from sending respondents SMS links to surveys. We are currently playing around with the option of the interactive voice response. We will see it typically works out really, really well when we are working with low levels of literacy. We've also launched a couple of social media surveys using Survey CTO as well as Qualtrics. Response rates are low, but the key factor in actually working with frontline health workers and sort of helping them understand why this is important has been our initial contact protocol that we worked on through a number of iterations and trying to actually gather a group of frontline health workers who will help us through the iterative process so that we are not taxing the entire sample. What we figured out is that the initial contact protocol, where we actually talk to them about why we need to collect data at high frequency, why the symptoms panel is useful, and then getting buy-in from people like ANMs or medical officers has sort of helped us alleviate a little bit in terms of people understanding that there is a shared goal in providing data, collecting data, and being responsible about it. I'm going to pause now, but I'm sure we'll get into more questions later.
Lovely, thank you so much. Super interesting. I think the idea of that first contact and how do you establish rapport, a connection, and convey the meaningfulness as well of this research exercise is really key. So that resonates. I see that Krishano's online. So Krishano, back to you. Not at all. Fingers crossed that that this will all work. I've been nervous all day. Back over to you. If you can tell us what you've been doing with the Data on Demand platform.
Yeah, definitely. So, I mean, overall, we have been experimenting with phone surveys for quite some time now. And this has been like good 8-9 months, like even more than that, actually over a year that we have started this this series of experimentations on how to actually use phone surveys. And this was obviously like before COVID. And that series of experimentation on when to call someone, what exactly to ask, and then how to ask for slots, like scheduling the call on a different level. So those things are specifically something that we already knew before even COVID hit us. So that allowed us to quickly shift from all in-person surveys to this phone survey-based surveys, which we have done like quite a lot till this point of time. And yeah, and then specifically, I think like alluding to the previous point that you were saying on how to like make sure that even with phone surveys, the data quality is like of top notch. think that becomes that's like something that we are like really sort of obsessed about. And I think our approach has been, even in phone surveys, literally the same that we approach in-person surveys, right? To just think that where errors can creep in. And typically speaking, errors will always creep in one of the three ways, right? So which means that there can be some systemic misunderstanding of questions by surveyors when they ask them. There can be falsification of responses and also misentry of responses. Now, to maintain this, to like get these levels down to a certain acceptable standard, what we essentially do is to figure this out into three different portions, which is what can you do in pre-survey, what can you do during the survey, and what can you do post the survey, right? And pre-surveys is something which is, again, like on hiring, on making sure that you are taking the very highest quality of surveyors who are locally based, and so on and so forth, and also making sure that the training protocols and quizzes and everything are like really great. And then moving to like during the survey, which is a bunch of high frequency checks to just think of what errors can creep in. And then even during the survey, one of the things that we are obviously doing is audio audits, a bunch of them. So two-way audio audits depending on consent, and that helps us to listen to this and replace back checks in a way that we can't do in phone service normally. That is very possible in in-person service. So that has been our like approach on keeping the data quality as a center. And I can speak like more about this, but I will stop here as of now. And yeah, let the webinar proceed.
Fantastic. So I'm sure we'll be coming back to you with questions. So we're making, I think, really good progress. Over to Shantanu. Shantanu, you launched the Delhi coronavirus telephone survey in part as a way to cope with the physical distancing that ensued post-lockdown in Delhi. And you had to transform your research team to implement remote surveys, even though you had done some experimentation with phone surveys prior to COVID. Can you talk about the challenges you faced in transforming your team into this remote work environment, and training and supporting them to implement a high quality phone survey?
Yeah, hi, thanks, Sunita, and thanks to NDQF for organizing this panel. Before talking about specifically about the challenges, couple of points I want to mention regarding data quality. Some of them have not been discussed. I think we could point those out. So, I mean, what constitutes good quality data? I mean, to simply put, the data having minimum, which is subject to minimum error, right? So all data are subject to error. So we just have to try to minimize the errors in the data. And it can be looked at from two dimensions. One is the data, the raw data, the variables actually that we are collecting, how we can minimize the error in that raw data, the variables we are collecting from the respondent. And the number two is the estimates that we produce based on the raw data that have been collected. So the errors in the raw data, the variables can come in several ways. So one is the questionnaire designing, as many panelists have mentioned, that it's more of a challenge for telephone survey because it has to be really simple and very specific, so that because in face-to-face, even if your questions are not that specific, there is a chance of back and forth clarification, etc., which is less likely to happen on a phone survey. So basically, if we think in terms of more of a standardized technique of interviewing technique versus conversational interviewing technique. So conversational interview technique is more common in face-to-face surveys, but for phone surveys, I mean, some respondents may be engaged with you, but most of the respondents won't entertain if you can't ask the question right way in the first place. And the second part is, suppose you have a very good questionnaire, etc. But if you can't convey that to your interviewers who will be collecting the data, I mean, that would lead to a lot of errors in the data. So that specifically we found very challenging, not in the context of phone survey as such, but more in the context of pandemic, I mean, lockdown, because the training the training needed to be arranged on a virtual platform. So that we found very challenging because different interviewers are located in different areas. Their internet connectivity is not always very good in many of the remote areas. So that was very challenging. And the way you can engage the interviewers on a face-to-face training, the way you can verify their knowledge, etc., which was very different for training on a virtual platform. So we tried our best, but that's something is really we found very challenging in the context of this TCP/TS. And then another is of course the interviewer quality, the interviewing style, that also can lead to errors in the data, the raw data we are collecting. So now coming back to the estimates that are being generated based on the data collected through phone survey during pandemic. So there are two key sources of errors that I can think of. One is the coverage error, because if it so happened that so basically we need a sampling frame of phone numbers in order to conduct the phone service, and if it so happened that a particular group of population, which can be a marginalized group, which can be a group, so basically if we don't have phone numbers for that particular group, and the variables that we are collecting, they differ from the group that are missed out from the sampling frame, that can lead to a substantial source of errors in the data, in the estimates. And another key source of errors, which one of the panelists mentioned, I mean, many of the panelists actually mentioned, is the response, which is a huge challenge for telephone surveys. I mean, you may end up getting even less than 50% response rate, 60% response rate. If you're lucky, you can get 77%, which we got for DCP/TS1. But on a serious note, the point I'm trying to make here, the non-response error is actually a function of two things. One is the response rate. Another is the how different your non-respondents are from your respondents. Even if you get a very good response rate, for whatever reason, you had their phone numbers from before, you had you had a rapport with them, but if the whatever percentage is left out, if that percentage is very different from the respondents that you capture in terms of your key outcomes, say you are capturing, say, reduction of income and many other things, if that's very different, then also it can lead to a substantial source of error, even if we have a reasonably good response rate. So I'll stop here and wait for questions.
Great, thank you so much. Yes, Samiran, over to you. I know that you are in the process of planning a survey, so it'd be great to hear about how you're thinking about data quality.
Okay, hi, can you hear me?
Yes, perfect.
Okay, today actually we finished the survey that we planned, and it's about healthcare workers who got themselves tested because they were symptomatic, and they got themselves tested, turned out to be positive or negative, and it's all over India. So while planning this survey, this was a interview-based, phone-based interviews and a survey. While listening to the other panelists, I realized that probably 4 T's could help us in terms of addressing the issues related to the quality of a phone-based survey. For example, the tool that would be used for conducting the survey, that's 1 T. The other T is about the topic that will be dealt with and the necessities around it in order to strike the quality. The third T is about the person who is trying to reach out to the respondent, and the engagement of the interviewer and the interviewee. So I will try explain. While the doctors and the interviewers were trying to reach out to people, we were asked the questions: where from did you come to know about me, and who are you? Can you show us your ID, and a few personal details. So it's very important for the team to discuss all these, and how much to share and how much not to share is very, very important. So building the trust, which is a very important T between the interviewer and the interviewees, is very important. But there has to be a clearly laid out plan for how much to share and how much not to share in terms of the personal identifiers of the interviewer. Actually, we were asked, who are you? Can you send us your ID? And we had to say that, okay, you can go to ICMR website and my name is there, I'm such and such, that sort of thing. So the trust between the interviewer and the interviewee is very important. The other T is time. When am I trying to reach out to somebody in terms of responses? Why is this important? Because we realized that many are sort of out of the anxiety that they had when they went through the testing procedure, but then they're back either, some of them, back either in the routine activities which might not match with the interview time. So if those time slots are decided upon, and if you are not hearing from someone, then when next would you try to reach out to? Because the moment you sacrifice the data, that would impinge upon the quality of the information that you are trying to look out for. So what is important is to think about the time slots, where, when, and how to call. In terms of the stigma, particularly, that's what we realized, because sometimes the respondents would call, because our survey was to try figure out, all of you, I'm sure, are aware about the chloroquine related issues, whether to use or not to use to protect myself as a healthcare worker against the possible infection. So that's exactly what we were trying to understand well. And we realized that the whole issue around stigma and the plights, because when we were trying to reach out to different levels of healthcare workers, many of them who turned out to be positive, they were worried or anxious about their family members. So how to address those anxieties? And in many a situation, they did not remain restricted to the topics of inquiry. So there, they would come up with many areas or issues of concern, which one needs to know how to address them. You know, you need to listen to that, and you cannot promise what you cannot fulfill. So not raising a false hope in terms of the issues that are being raised was very, very important. So in essence, what I'm trying to say is that although you are trying to have a very short questionnaire, maybe quantitative in nature, but there will be qualitative responses, and you not only need to record them, but also try address some of them, but not necessarily raising a false hope. All of these have got tremendous effect on quality, because it's all about the relationship that is getting built through a phone survey while you are reaching out to someone. But if the team members or the interviewers do not address these from beforehand, on the job, on the spot, it would be very difficult to figure out what to commit and what not to commit. So these are some important issues, I think. I mean, we had to learn it by doing, honestly. And the other things I'm sure that many of the panelists have touched upon in terms of keeping it short, keeping it simple, keeping it straight, not too tortuous. So those are there. But topic-wise, I think COVID-19, as we are focusing on that, it's a sensitive topic. So we have to realize that the participant is located within a context, which is not only disease context and health context, it has certain social issues around it. And addressing that, understanding that would have tremendous impact on the quality of the data that we would be generating. Thank you.
Wow, thank you so much. So I think that was a super eloquent panel. And if I can borrow Samiran's 4 T's, you know, I'm hearing 5 T's as being really critical. One is really thinking deeply about the tool. Shweta started the panel by talking about reflecting on what's the ultimate sort of outcome that we're looking for through the data collection exercise, and ensuring the tool is as simple and as brief and you know, as sort of the least burdensome as you can have it, but still enabling you to produce sort of the insights that are needed for that ultimate objective. the training of the team, and there are some questions which I'm going to now ask the panel to reflect on. And the trust that gets established, and the trust, it's not a one-time event. I think the way in which the interviewers engage with the respondents also have implications for whether people will engage in these kinds of surveys in the future. Of course, I think interviewers too are in really difficult situations in terms of listening to people's troubles. And I think equipping and training interview teams to be able to handle these stories of distress, the communication of distress and being able to help address that is really important. The timing of these interviews, Krishanu also talked about the importance of at the get-go when you reach a potential respondent, making sure, confirming that it's a good time to talk or otherwise scheduling a future time. Let me take some of the excellent questions that have come through. So let's see, I'm just doing them randomly as I'm getting them on the phone. Shantanu, how are you dealing with non-representativeness due to not reaching certain groups without phones? And actually there are multiple questions, and so maybe I'll ask the panel to quickly, in a minute or so, talk about how they're addressing this. Number of people are asking about what happens if signal is spotty in certain areas? What happens to the people who may not have mobile phones? How are you getting the phone numbers? Do you have a representative group of households? And then how are you able to ensure that that representative sample can actually be reached through phones? So both, how are you accessing the phone numbers? What happens when there's spotty connection or network? And what are you learning about the representativeness of the populations that you have ended up interviewing? Let me start with Shantanu, but then I'm going to call on the others as well.
Yeah, so in our Delhi NCR coronavirus telephone service, we had 2 rounds of survey. So in the first round, we have used a sample that we have been following for the last 3-4 rounds of data collection have already happened with them through face-to-face survey as a part of our Delhi metropolitan area study. So we had their validated phone number. So that way it was easy in the first round. So that's why we also got a very reasonably good response rate. And but in the second round, what we have done, we have used the house listing data that was collected about 1.5 years back. And when we used that data and got the phone numbers from there, we realized that many of the phone numbers don't work now. So they are either not in use or so the respondent has changed their phone number. So that's why our response rate was much lower. But I would say that in terms of coverage, we didn't face much issue because our original sample was collected through this 3-stage stratified cluster sampling design. So that way it had good representativeness. But at the end, when you account for non-response, the sample we got, so there we have to see, like for the first round, we have a very good response rate, but those who did not participate, they are usually those who dropped out. They have not dropped out at random. It's usually what happens, the urban households, the richer households, they usually get dropped off, right? So, and when we are collecting information on income reduction during COVID, etc., then of course that has a very strong impact on the estimates we are producing. So that challenge is there. I mean, there can be some weighting adjustments can be done, but that's something to be aware of, I would say. And yeah, I think, but what happens in the second round, although we have a reasonably lower response rate, like 64%, but most cases, like 22% of them, we couldn't at all contact the household or a respondent. So probably they have changed their phones and something happened. So that I would say it's more happening at random. People are getting second SIM, people are changing phones. That, I mean, that's my hunch that can happen still more at random compared to those who are actually dropping off from your survey. So that way, as I was mentioning, there are 2 components. So we have to see like how the respondents are different from the non-respondents as well as the response rate. So both contributes to the error. Yeah.
Fantastic. I think as you dig further into your data, it'll be really interesting to learn more about that. Shweta, I'd like to hear from you. How have you dealt with, issues of network access, as well as, how did you gain access to phone numbers, etc.?
Sure, happy to jump in. So we've been working fairly closely with our survey partner, Kantar Public, and they happen to have, over the years, across many different studies, collected a sample of low-income household phone numbers that spans, well into the several hundred thousands. And so that's actually been a real blessing for us in this time, because what that enables us to do, because it's so large and it's across the country, is it enables us to actually reach kind of the types of populations that we're looking at: low income, rural, urban, men, women, etc., with a fair bit of confidence, because they just have so many numbers in their database that we can run through. And we've also had the luxury that actually our response rate has been relatively high, in the kind of 40 to 50, 60% range over the last month or so, even as we've implemented multiple rounds. And so I think that's been kind of the biggest driver of why we've been able to collect the data that we have and feel confident about the quality of the data. I think, honestly, the thing that really kind of makes me scratch my head at night is the question that you asked earlier, Sunita, right? Which is, there's lots of people who don't have phones, right? So there's people who don't have phones in the first place. Then there's people now that we're seeing reports of people just not having access to recharge their phones. So that's actually adding to the bias that may already exist. And often these are the people who are the most vulnerable and the most marginalized. And so how do we represent their voices when we have conversations with the government and other folks? And is our data kind of painting an overly rosy picture, because given that we're excluding the people who are the most marginalized from our survey data? And look, I don't have a great answer, right? Because at this time we can't reach them, because we can't reach them through phone, and that's really the mechanism that we have. And so coming back to this idea of responsibility, the thing that we've been really focused on is being really clear about what our data is and what our data isn't, and making sure not to misrepresent any of our data as we have conversations with different individuals, and to essentially go wise-eyed open about what those biases are, and make sure that every person that we share our data with knows those as well, and it is very clear about what therefore the implications are.
Thank you. So Krishanu, hopefully you're still online. Couple of the questions have been around, how do you assess interviewer quality? The quality of your training and the quality of the interviewers. If you can provide a little bit more detail on that. And several questions are also around, do interviewers use their personal SIM? Is there a central calling facility? And how is data privacy assured? So could you comment on that? Okay, he might be having some trouble. Tithi, I'm wondering if you had any insights on those questions.
Sorry, I'm back. Yeah.
Oh, Krishanu's back.
Krishanu, are you back?
But I didn't hear your question, so if you can repeat that.
Okay. All right, so the question is, there are a couple questions. One is, how did you assess interviewer quality? How did you determine that your training was sufficient and that they are reasonably equipped to initiate the interviews? Were the interviewers using their personal SIMs, or was there a central calling facility? And how did you handle data privacy? Are there data privacy issues when people are using their personal SIMs?
Yeah, definitely. Yeah, so those are all very relevant questions as of now. So first is that, as I said earlier, that we have a standard way of recruiting interviewers who are locally sourced, and we have been working with a lot of them across about 10 states in India as of now, and we keep on going back to our network, which is semi-permanent in nature. Now, recruiting surveyors, we have a multi-stage process where there are interviews by senior network managers, and then written tests and everything, which give us an indication of how good the surveyor is. And then after that only, the surveyor is actually offered to participate in training. And then after training, when there is a set of questions that the surveyors need to answer, and after we are convinced that they have answered the questions rightly, then only a final contract is given to actually do the survey. So there is roughly I would say like anywhere around like 60 to 70% of surveyors are only taken, and the rest are sort of not taken in the main survey. So that's how like we at the first level we ensure that the surveyors are of great quality, and also past experience matters. We normally try to take people who have had experience in the same topic, or at least like have worked us with for a long period of time. So that's one. Now, quickly moving on to the next part, which is, and I will actually come back to this because there is some experimentation that we are doing on how to actually make this process even better. Now, coming to the second part on the privacy issue. So yeah, obviously we don't encourage people to call directly, and we use Exotel, and this is the same thing that Tithi was also alluding to. So we have a plugin that we have made internally, and people who want to use this can also use the one that JPAL has actually put out as a public good. So that plugin is something that actually masks the number, the calling and the phone number that is going to be called. So no one sees the other one's number, right? So that's a base way of making sure that happens. But in some cases, it definitely happens that the calling software doesn't, which is Exotel in this case, doesn't allow you to place a number, and this may be happening because of DND issues and everything. There we allow the surveyor to actually do the call from their phone, but we have a data protection policy which makes sure that this is not misused, right? And then coming back to the issue of how you identify the best surveyor, I think that this has been grappling, like we've been grappling with this for quite some time, and we are actually right now creating like a machine learning AI model that, based on past performances, help us to identify where possible errors can come from, and that is also true at the surveyor level. This can also be at the question level, this can also be at the section level or something. And I think that this sort of a model will help us in even pinpointing what support and what extra checks that you need for a certain group of surveyors. But yeah, this is in development, but I'm hoping that this will also be a good public good as we go ahead.
Fantastic. Tithi, both you and Samiran talked about reaching out to frontline healthcare providers, frontline health workers. A couple of questions related to reaching people at the front lines. For one question is, are there, given your experience, are there questions that you think we shouldn't be asking? Because they're generating distress, or because you find that this really, it's too sensitive to explore through a phone survey. And second is, are you finding that the phone survey method may be working well with key informants, but perhaps not as well when you're implementing it at scale within sort of a community setting? Tithi, why don't you take that first, and then I'll go over to Samiran.
Sure. Thanks, Sunita. So in terms of the frontline health workers, we've actually learned quite a bit in terms of what they are going through. In fact, like I mentioned earlier on as well, we didn't just dive into data collection. We actually decided that we need to have a few one-on-one qualitative interviews to start with, to try and understand what exactly. There were a lot of reports coming out in the media in terms of what frontline health workers are going on, the kind of violence that they are facing, but we actually wanted to hear it so that we could make sure that our instruments are sensitive enough so that they are not causing more problems than less. The second thing I think we were very, very careful about, and this is not just for the frontline health workers, but it's for all the surveys that we are running currently, is sort of thinking about a fact-checking module. It again goes back to the responsibility point that I was making, that whether it's frontline health workers or, say, for example, any key people in the village or respondents in general, when we are asking them about their knowledge related to COVID-19, whether it's attitudes, practices, that's secondary, but even if it's knowledge, and at the end of the survey, if you realize that they have less knowledge as compared to what you would have expected, or they've they don't know the critical points, I think it's greater responsibility for us to correct them. So this is something that our principal investigators have built on, and we are more than happy to share that if there is any demand. But that is the key point of this particular aspect, which feeds into the frontline health workers as well, is what we realized is two things that they were extremely sensitive about in terms of the kind of stress they are going through. And technically, this was not going to be, our survey wasn't going to focus on mental health and stress and anxiety in general, but we were just interested in what they are seeing in the field. But what we realized is this itself, whatever they are seeing on the field, the kind of pressure, the time pressure, the pressure to act, everything depending on them, because they are sort of the base of the pyramid of the rural healthcare system right now. It was in turn causing a lot of stress. So that actually gave us the I would say the inspiration to actually design an intervention around it, where we could be providing frontline health workers along with more community influencers to have safe space to discuss amongst each other what kind of, because this is something people are facing for the first time. There is no playbook. So if at all they could find a safe space where they could share the experience and understand that they are not alone, they might feel a little more empowered towards making certain decisions on their job. So I think more than the instrument for us, it was more about, what more could we provide them with. The second thing definitely was, we were extremely, and this is something I think Samiran also alluded to, is the trust that we need to build, whether it's through the kind of experience we are giving them based on the interviewers being trained or how they are interacting, but also the time that you're taking from them. If they are going to be spending, say, 8 hours in the field trying to figure out who is sick and who's not sick, coming back to answer questions about that, there needs to be some amount of sensitivity in terms of how we deal with things. So what we had decided, like I mentioned earlier on as well, the initial contact protocol was extremely useful for us and them to come to a reasonable understanding in terms of what is expected from them, and the fact that we understand that their job is really hard. And that I think has...
I'm going to have to shift to Samira because we've run out of time. I want to make sure the second panel also, we have adequate time to engage with them. Samiran, last word. Lots of fabulous questions to all these wonderful, amazing, intelligent people out there. If we don't get to all of your questions, we're going to provide responses via the NDQF blog. Samiran, last word. We can't hear you. You have to unmute.
Yes, can you hear me now?
Yeah.
Okay, all right. Thank you, Sunita. I think that the question that you asked is so very important. How much to ask, how much to intrude, and not to go further. I think that the source of anxieties are basically three. One is that somebody has called me to ask questions in itself could, evoke anxiety. The second is if somebody is asking questions, which is testing my knowledge, that's another source of anxiety. And the third anxiety is from my experience. So we have seen that COVID-19 infected individuals, they volunteer information. So allowing space, conversational space, not necessarily having a judgment, would be very, very important. So not to intrude, but to have empathy and careful listening, patient listening is something which is very, very important. And again, from the other side, the interviewer would be actually overwhelmed by the qualitative information that some of the infected individuals or individuals going through the stress would share. So handling that feeling of getting burnt out is also very important. So I'm basically talking about both the sides. The interviewers need to know how to handle the situation, particularly in terms of the qualitative responses, and on the other hand, how far and after which point we should not. But the patient hearing is something which is very, very important, not necessarily intruding. So allowing a conversational space without a judgmental approach and not giving a feeling that you are being assessed for your knowledge are something very important to know in order to have a successful quality interview. Thank you, Sunita.
Fabulous. I think really fabulous note to end this panel on, and that is really the importance of exhibiting, sharing compassion and empathy. that we're all in this together. Some of us are suffering far more than others, and I think those of us who are so privileged to not be suffering as much have a duty, have a responsibility to convey and to highlight the sources of suffering of others. And I think while we do that, we need to be taking care of ourselves. We need to be taking care of our research teams. So let me give you a big round of applause. Everybody else is on mute, so they can't applaud you. Thank you so much for the hard work that all of you are doing. I am going to quickly turn over to the second panel. Hope all of our webinar participants are hanging in there. It's going to get it's going to continue to be interesting. I won't say it's more interesting because we have so many interesting questions as well that the first panel has sparked. Okay, so panel 2 has Arya Venugopal, who leads the Jan Sahas research vertical and has been carrying out in-depth research on forced labor, internal migration, and sexual violence. We have Karima Khalil, a consultant with Oxford Policy Management in New Delhi. Karima is a public health physician and co-leads ethnographic research on facility-based RMNCH service provision, particularly in the state of Bihar. We have Aditeshwar Sheth, who is co-founder of Gramvani, a social enterprise that uses appropriate technologies to operate participatory media platforms for rural and low-income populations. Adi is also faculty in the Department of Computer Science and Engineering at IIT Delhi. Next, we have Shruti Yeramili, who anchors research within the data-driven governance across sectoral portfolio at the Tata Trust. And last, but again not least, is Amnesty Lefebvre, who is Associate Professor at the University of Cape Town with a joint appointment at Johns Hopkins School of Public Health and has over 18 years of experience evaluating innovations in RMNCH in low and middle income countries, including digital health solutions. So with no further ado, I'd like to turn to Arya first. Arya, can you describe the mammoth effort that you and Jan Saha's colleagues have undertaken to gather insights on the plight of migrant workers? In the second round, or perhaps first, I'd like for you to describe how you've addressed data quality. So it's up to you. We can either do this as 2 rounds, or if you'd like to just go ahead and describe the work that you've done to capture the experiences of migrant workers and how you address data quality.
Right. Thank you so much, Sunita. I'll try and address both actually together. As all of you would have already been, as you've all read our report, Voices of the Invisible Citizens, it's already out there. We've already published. Our primary task was a rapid assessment. As we are an implementing organization, we were working with these communities prior to the lockdown. So for us, our primary task was to actually understand the needs, condition of the migrant worker in relation to the shutdown and the subsequent lockdown. Of course, we have a 100-member strong team who's actually continuously, who's been working for the last 2 years on registering, tracking, migrant workers, helping in the processing of providing them social security benefits, in recovery of wages, and several other activities. We've also been following up with them to understand various other indicators in relation to forced labor and other aspects. So having said that, we also run a helpline for the same community. So we were already aware of the distress. And in fact, prior to the lockdown, we were already receiving a huge number of distress calls from workers of having lost jobs and wages. With this actually in sight, we had our first draft of our questionnaire ready even before the lockdown announcement, in fact, because we actually wanted to reach out and find out what's going on the ground. And of course, we then had various iterations of the questionnaire itself. I'll speak a little bit more about the training and the data part of it in a second, a little bit after this. With this, yeah, so as I was saying, so on the research front, to specifically talk about at that point, what we ended up, we actually carried out the research with all the steps. We actually had 3 different iterations of the questionnaire itself. We wanted to keep it simple. We knew we were reaching them at a time of extreme distress, and we wanted to find out ways of how to actually help them and address these issues. And so we had a pilot to ensure that the survey questionnaire wasn't missing any mark. And of course, we had a training session. We had to quickly think on our feet how to best do this, because our training, our surveyors were actually field officers on the ground. And what we were, we also had these team members also had prior experience of doing surveys, because they actually technically do surveys. They've been doing surveys in the last 2 years or so, and they also have access to tablets and phones, and therefore that made it easier. And we decided to train the 40-member team on actually conference calls, to ensure that they would follow the script. They had a certain understanding of what they were supposed to do. So we had to think on our feet at that point. And we consciously decided to not mask phone numbers, because we are field officers, we are social workers. We wanted to ensure our communities could reach us when they wanted to reach us. And through the survey, just to also specify on the ethics aspect, we identified tier 1 cases who were at risk, and which emerged organically, which is not part of our questionnaire itself, but they started narrating their issues that they were facing. And we had a whole, because government helplines at that point were not working and were not up to the mark, we actually increased capacity of our own helpline to try and address these issues. We had a separate needs assessment response group who was working full time into actually addressing the crisis in hand, and that emerged to be our response mechanism in terms of cash transfers, Russian support, and all the other gamut of work that we're doing on the ground today. We closely monitored the progress of the survey. Of course, we had deeply committed surveyors who were very connected with the community. So data fudging was not something that we were very concerned about at that point, but we still actively monitored the progress of the survey. We had about a 53% response rate. What we understand is, of course, we were calling them at a time of distress, so a lot of phone numbers were switched off or incoming calls were barred, and hence there were some issues with the response rate. But otherwise, we thought that was a good, we could reach out to so many. In terms of the data quality, in terms of the phone numbers in our respondents, as I mentioned, we've been collecting these phone numbers in the last 2 years, and already we've gone through 2 layers of screening, where we first register, there are inclusion criteria of who is part of our registering in our database, and then a second round where we follow up and ask them. So anyone who's actually not fitting the criteria, who we don't know are migrants specifically or haven't migrated in the last 1 year, were already weeded out of our first 2 layers. And hence we had a very good quality of respondents at that point. If I have to specify a small challenge, it would be representativeness. And I think this is an important conversation to have, specifically because, I mean, given the society that we live in, we all know that men act as gatekeepers when it comes to access to phones, and women do have, directly reaching women is not that easy. And we did see that in our survey too, even with workers, migrant women, female workers that we had actually registered. So yeah, that sort of overall sums up what we did, largely to tackle data quality and what we did around the research front. In the next, as a next step, we are actually planning a more in-depth study of our community to understand, as we are an implementation organization, everything we do has to lead to an actionable step. So we are seeing a lot of stigma, a lot of trauma, a lot of loss of dignity on the ground, financial distress, mental distress. So our next priority is to be able to intervene with the right programs and interventions, and our research is going to be focusing in the next phase to address these issues. I'd like to stop here and then take questions if anyone has anything. Thank you.
There are lots of questions already, but I'm going to keep going, and then we'll come back to the questions. Thank you so much, Arya. As I had mentioned on a previous call, really find the work that you've done very inspiring. So next is Karima. Karima, OPM is one of the few organizations that I know who has been engaging in ethnographic research and now moved ethnographic research over to mobile phones. Can you describe what you're exploring and via your digital ethnography and how you're addressing data quality.
Thank you, Sunita. Can you hear me?
Yes, I can.
Okay.
And you can turn on video if it's feasible for you, but no pressure.
Yeah, I was trying to do that a second ago and it wouldn't respond.
No worries, we can hear you, so go for it.
Okay, yeah. Well, thank you very much for including me in this webinar. It's certainly, everybody has raised a lot of issues here that we've been thinking about ourselves. Let me tell you, I'm going to speak now about the very small ethnographic study that we've been doing. We've been engaged with two primary healthcare facilities in Bihar, where we have been contacting the providers regularly, roughly every other week, to understand their resilience in the face, the resilience of the health services in the face of the pandemic, and the adaptive strategies that they're developing to respond to these challenges. The idea is to collect information quickly, collate it, and draft notes that are shared then with yourselves at BMGF and with CARE, other partners on the ground, as quickly as possible to reflect the fluid situation on the ground. Now, we're benefiting in that study from the fact that we are basically, it's a continuation of an ethnographic study that we already had that was already ongoing. OPM had been conducting a small-scale ethnographic study at these two facilities since roughly the middle of 2019, where we had teams, very small teams of social scientists and nurses based, sort of embedded, as it were, at these facilities for 3 weeks at a time, conducting in-depth interviews, direct observation deliveries, conversations. They're basically at the facilities all day long, every day for 3 week stretches, sometimes 4 weeks, and then 3 weeks off, and then they'd go back for 3 to 4 weeks, and then 3 weeks off, and then 3, etc. So what I'm trying to say here is they develop very strong relationships with the providers there in terms of very high levels of trust and a very high level of belief that what was being shared with us would not risk their positions in any way. We gave them very high assurances of confidentiality and anonymity, which all of our partners respected. And with time, they became extremely candid over these last few months about the challenges that they were facing. And we were able to understand the sort of dynamic contextual factors that affect service delivery and the quality of service delivery, which was our overall objective. So given the different biases that come with using phone surveys that we all, are struggling with here, every panelist has described a range of them, and we've certainly thought of them as well. We do have the advantage that there's a very high level of trust and confidence and a good relationship between our enumerators who call up the respondents every week. So this, we've been quite taken aback almost by the level of very rich and contextualized information that they've been sharing with us. And though we do, of course, have some concerns in terms of, there are limitations, of course, to this approach. And the main limitation is that it's a very small sample. These are just 2 facilities. I envy everybody on this webinar who's describing working in, 15 states with, I don't know, X number of respondents. And we do have another study that we're awaiting to get permission for to do a larger phone survey of providers, but that's another subject. We hope that we get to that. But in terms of this particular study, of course, one of the limitations, like I said, is the small sample size. However, we do feel that that is somewhat compensated for by the richness of the information that we are being given. Of course, I'd like to stress, as I think Shweta mentioned, we're very, very clear about what our data is and what our data isn't. So we're not talking about, this isn't a quantitative survey. These aren't necessarily facts. So of course we try to triangulate as much as we can when we are in the field. But these are the perceptions of the providers, and we have to be very careful when we transmit our information to emphasize that these are the providers' perceptions. Having said that, these are valid perceptions. This is how they see things. This is how they see their workplace. This is how they see the challenges that affect the quality of care that they're able to deliver. We do try to triangulate as much as we can, but I'd like to emphasize that because we try to call these providers once a week, and we try to collate a 10-page note that then we share with our partners every other, on the subsequent week. So because the situation is so fluid and it's very time sensitive, sometimes we're not able to go back and triangulate with as many respondents as we would like to, or we would be able to if we were physically in the field. But we do triangulate and check back and double check and call back as much as we can. And people so far have been extremely happy to talk. They almost see it, I think, as a venting exercise or a way to get their voice. I think that they get their voice transmitted about the challenges that they are facing in a very open and candid way. And I'll stop here right now.
Thank you so much, Karima. I think what's really striking about both Arya's work and your work is, how much people are giving in terms of, sharing their experience, their perspective. 50% response rate from individuals who are in the process of moving, evacuating, etc., is actually a stunningly high number. So moving on to Adi. Adi, the mobile Vani platform has proven to be a powerful mechanism for both information dissemination as well as gathering and documenting people's stories and people's experiences. Can you tell us more? And can you tell us a little bit about the quality of the data that you're getting through the mobile Vani platform?
Hi, yeah, thanks everybody. I hope you can hear me. Suddenly the audio quality has depleted at my end. It was fine until a minute ago. But if you can hear me, that's great.
Yes, hearing you well. I'm going to turn off my video just in case that's causing problems. Go ahead.
Great.
Go ahead, Adi.
Yeah. Cool. So Mobile Vani, we've been running it since many years, more than 7 years now, across many different areas in rural Bihar, Jharkhand, Madhya Pradesh, and since the last couple of years, we've also started working in urban areas with industrial workers. And this is a platform where users can call through a regular phone call. So it's an IVR-based system, which means that people don't need to have an internet access. They can call and they can listen to information, and they can also record audio messages. So it's a two-way interactive platform, and we've set it up that way so that people can share information with one another. They can ask questions, they can answer questions for one another. And over the years, Mobile Vani has been used for many different use cases, right from health and nutrition to agriculture. And grievance redressal has also been one of a key elements in this program, where people call and record problems they're facing with government schemes and other things. And through a network of volunteers, we help try to address these problems. So during the time of the pandemic, this really became an asset because we had a user base that was already using Mobile Vani. So overall, it's about 100,000 monthly unique users who use Mobile Vani in different areas put together. And they started talking about all the problems they were facing. And then our teams also on the ground started responding to these problems on ration, on cash transfers, on support for migrant workers to go back home. And on all of these issues, we worked with partners who have then helped work on addressing many of these problems that people were facing. So Mobile Vani was able to provide a very nice sort of ear on the ground on the situation. And we have had a lot of in-depth information that users have shared very proactively. So right from problems they're facing in ration, but also why they're facing these problems. So in case they don't have a ration card, or their Aadhaar linkage is broken and that's why it doesn't work, or they have biometric failures. Similarly, for cash transfers, problems with Jan Dhan, problems with the PM Kisan, that many of them weren't enrolled. Many of them were enrolled, but the bank KYC was broken. So all of that very rich information has been coming in the voices of the people themselves, which was very useful for us to quickly understand why these problems were happening, and then accordingly suggest to our volunteers how they could help the communities redress some of these issues. So that was one important use of Mobile Vani, and we then also have written lots of letters to the administration to alert them about some of these issues, and in many cases the administration has accepted those very proactively, and they've also worked with our teams on the ground to address some of these issues. Another capability on Mobile Vani is that we can also run IVR surveys. So these are basically a set of 8 to 10 questions that we can put together, which can have multiple choice responses. So of course, the questions need to be very simple, straightforward to understand. The options also don't need to be a lot, right? So if you have options, people normally are able to comprehend up to 4 or 5 different options. Beyond that, they also get confused and start forgetting. So keeping those constraints of IVR surveys in mind, however, given the fact that we have this user base who calls regularly, we put up these surveys, and very quickly we're able to get a lot of responses, and which again is able to paint a quantitative picture as well, in addition to the qualitative voice reports that we are getting from the people. And we've used all of that to write reports, to write in the media also about these different issues. So just a quick couple of points on data quality. That so of course, because people are responding on their own, so we don't know, right, how many are speaking the truth, how many are lying, right, and that sort of stuff. So we have very little control over that. But on the IVR, what we try is that we only look at responses by people who attempted all the questions. So throughout our surveys, we found that there's a very nice bimodal distribution in these IVR surveys, that a whole bunch of people start attempting this survey, but then they drop out after 2 questions, 3 questions. So they said that, well, maybe something interesting, that we try it out. So they start answering, but after a while, those who are not serious, they drop out. And the ones who are really serious, who want to participate, they stick on. And therefore, there's a merit to keeping a longish kind of a questionnaire, because then you can only look at responses of everybody who answered the complete questionnaire, or let's say at least 8 questions, at least 10 questions. So that's useful. So in the past years, we have also tried doing an accuracy check on some of the errors that the panelists were talking about. So both in terms of people's ability to comprehend the question, that they comprehended correctly and gave the right answer, which they intended to give. Also on errors where they might have pressed the button incorrectly, and then there's no way for them to now change the response. So these were, of course, each domain is different. Each user segment that we might want to target may have different capabilities with technology use and everything. But in a survey that we had done where we did this more extensive accuracy testing, the results are very encouraging. So this was specifically with community health workers on assessing the quality of care, and we did these in partnership with C3, Center for Catalyzing Change. And we found accuracies in the order of 85% to 90% on different types of errors. So that was quite encouraging.
That's great. So Adi, I'm going to ask you to wrap up.
Sure. Yeah, no, sure. I mean, we can answer more questions later on also. So we can move on.
Perfect. Next up is Shruti. Shruti, the Tata Trusts have been working on fostering data-driven decision-making at local levels. You've assembled a large number of community volunteers who've implemented a massive phone survey across 85 aspirational districts across India. Can you tell us a little bit about what you've learned about assuring data quality through these surveys?
Thank you so much, Sunita. Yes, so somewhere late April, I think we finished our COVID rapid assessment survey. These are also the districts, these 85 districts are also districts where we had continuing community presence from projects before. Like across all other Tata projects, all of our other projects, it's very important for us to be able to train and be able to work with people from the community itself. It's important both from the point of view of building community resources, and also from the point of view of ensuring that we are aptly able to capture cultural context and cultural context during the process. The rapid assessment survey was very different from some of the other surveys that we've done in the past, and the surveys that we've done in the past have always been in-person surveys. So one of the first things that was important for us was to really sensitize all our enumerators of the nature of the kind of the situation in which the survey was being rolled out, the differences that they may experience while rolling out a survey or while asking questions over a telephone versus actually sitting in front of somebody and then speaking to them. So while our community members, our enumerators have been trained for over 2 years in these locations, it was important for us to sort of reorient them for a telephone-based approach, a phone-based approach. The survey was rolled out in sort of like a hybrid model. The communication link between the respondents and the enumerators was the phone. However, for the enumerators, we deployed our survey tool on our Delta app. It's an in-house app framework that we developed over taking the experiences of other surveys that we had conducted. The enumerators are quite used to that kind of interface, being able to work through the survey questionnaire through the app format. So it was also convenient for them. It also ensured on our side that the efforts of the enumerators were completely directed towards understanding their respondents on the other side and interacting with them, and less on the logistic fronts of working with a paper-based system or any other form of survey. I think from the point of view of ensuring that the survey was extremely relevant and parsimonious in some ways, I think we've covered this in panel 1. I think the issue was covered in panel 1 discussions as well, but I think I'll reiterate it here that it was important for us to sort of set the right expectations with our enumerators. The fact that this was an assessment survey and how far and what to commit to the respondents about our involvement, and also to ensure that the questionnaire the questionnaire was not misleading in any way and did not create any hopes and expectations on the part of an already distressed community during the process as we probe them and ask them about, for instance, awareness aspects or trying to understand their levels of preparedness or access to preventive measures, etc. It was extremely important that that level of sensitivity was maintained. First was, of course, on our level when the questionnaire design was done. The second also was when we piloted the survey and over the test run, ensured that we took very seriously the feedback that we received from our enumerators as well as from the sample on which we had piloted the survey, to ensure that the context was right, and we were only asking questions which were absolutely important to the objective we had in mind. Any questions which could be misunderstood or misleading or ambiguous in any way, we tried to avoid in our survey. The other aspect of data quality was also we worked. I mean, from a process flow point of view, we also have. Like I mentioned, the Delta framework before. It's a combination of the Delta app on which our survey was rolled out, and the Delta platform, which is an interface for the nodal project team, which and also our district and state enumerators and coordinators, that allows them to monitor the progress of a particular survey over various parameters. Since this was the first telephone-based survey that we were rolling out, it was very important for us to make sure that we looked at progress or monitoring the survey from a very different lens. To give you to To give you an example, usually the surveys that we roll out are quite large in sense of the size of the questionnaire, and we have time to engage with the community, with the respondents deeply. We have time to build trust, and then sort of get to the point where we are actually asking them expansive questions. So on the data quality or error monitoring sense, it gives us the opportunity to build in quality checks and indicate specific indicators where we are able to check the data on the fly as it's coming in to see if we are receiving any responses which seem very off what is expected, or if there are any anomalies in the responses that we are receiving. And we're able to go back to the surveyor and speak to them about any issues they may have faced, or if need be, reroll the survey for that particular, open the survey again for that particular respondent in case there was an issue. However, in a telephone-based survey, we don't have the leisure of time. We don't have, there isn't the space to reach out to the same respondent all over again. It's distressful for them. It's difficult for us also to reach back to them. So it was important for us to monitor the information that was coming in from the surveys on a daily basis. As the numerator enters the information.
Pause, because we are kind of running out of time. I think you brought up a really important point, which is also the extent to which the survey teams have had to work sort of 24/7. You know, really keep track of data as it's coming in real time, because there is no luxury of time. So I think that's a really key point, and one for us to keep in mind, because these are really exhausting surveys to do. With this, we are 5 minutes to the close of this webinar. I'm going to take the liberty of maybe taking another 10 to 15 minutes of people's time. I see that we still have 268 people online. And I'm going to turn to Amnesty. Amnesty, you've led numerous phone surveys, you've evaluated mobile technology interventions in India, and you've synthesized the evidence on mobile-based interventions across the world. So can you kind of help bring this whole conversation together, talking about the range of data quality challenges that have been identified, the factors that drive data quality, and maybe commenting a little bit on the ethics as well, particularly around doing surveys in the context of the pandemic?
Sure. Thank you so much, Sunita. And it's been really a pleasure to listen to such important insights from a range of groups working today. So thank you for that. So I wanted to speak to a couple of issues, both at once to sort of synthesize some of the discussion today, and then maybe add in some points based on some of our experience as we go through. So the first thing is, I think some of the sort of really interesting discussion around design, both in terms of needing to be a sort of a short survey that respects the time constraints of respondents and enumerators alike, but that's also very topic and outcome focused is very important. And I think the consensus across all groups so far has been that there needs to be a minimum number of questions, and you need to focus on only the priority information, short, simple, respectful of respondents. I would add to that that I think we have to design with the modality in mind. And this sort of links a little bit to the larger ethical considerations, which I feel sort of underscore everything that we do. And I think that we have to really consider from the outset what the ethical implications are of asking about particular topics. And I'm thinking in particular about mental wellness and gender-based violence and possible other sources of distress. Here in South Africa, where I'm based, we have taken a call on phone surveys, at least that we're engaged in, not to ask questions that could potentially relate to larger health systems demand where we don't have the capabilities of meeting that demand. So for example, if questions could elicit self-harm, or if in the case of gender-based violence, respondents potentially are in the presence of the person that is inflicting harm upon them, and the COVID restrictions are going to potentially, we can't guarantee their safety, we have decided not to necessarily ask those questions, at least our group. And I would note that I have been approached by at least half a dozen groups doing phone surveys that don't have that same sort of ethical code. And their questions have all made it through different IRBs. And I think that's a little bit of a troubling reflection that I'm seeing, at least in this environment. And I think it's something that we have to really sort of think about in terms of, you know, who's answering the phone, who's around at the time of the interviews, and what are our sort of, you know, responsibilities as researchers to make sure we're taking care of our respondents. So beyond that, I wanted to, we sort of reflected a lot today on issues around the design of the tool itself. I thought at the outset there was a sort of a lovely kickoff to the discussion, and I'm going to butcher names with my Texas pronunciation, so I apologize, but a lovely sort of discussion around some of the ethnographic work that has been done to really iterate on both the sort of the content of questions by some groups and the translation. And I would just echo that we have done that also. My colleague Carrie Scott is on the webinar here, and she's published a nice article on cognitive interviewing. And from some of that work, we found that longer Likert scales are just a no-go with rural, low literate women in Madhya Pradesh. And I imagine that would be an experience that others echo in this audience. So I think we just have to be careful when we make inferences around the types and the wording of questions and what is perhaps, you know, suitable to a middle or higher income audience versus, you know, women that are low literate in rural environments. Along with the sort of design, typically, you know, we have tried to follow a very rigorous validation process where you start with face-to-face, and that is repeated twice, and then you go into validating the phone survey as compared to sort of face-to-face responses. And unfortunately, I get the sense from, you know, respondents from the group today that that kind of routine validation process isn't, you know, possible within the current, you know, travel restrictions. So I just think that means that we have to take extra care in the conclusions that we're drawing. And linked with that is this larger issue around the sampling frame and who are we representing. And while there were some very helpful discussions around the need to build rapport, the need to get quality phone numbers, I think ultimately at the end of the day, I would come back to the big picture, and that is only half of women in India have any access to a phone. And what we found in Madhya Pradesh anyway is that only 38% of women have access to a phone during the day. And then on top of that, there are varied levels of digital literacy. So if we're asking, particularly in the context of SMS or other types of surveys, if we're asking women to even do the most basic functions on a tool, we're really restricting, you know, we get a very restricted population, and that doesn't include the poorest, the most vulnerable, the most marginalized. And so the voice at the end of the day that our data are representing is very skewed. And I think that needs to very much come, you know, at the forefront of any conclusions that we draw about the data. And linked with that, of course, is that we do have high rates of SIM churn and high rates of individuals that have zero balance on the phone. And then the last thing I just wanted to reflect on, because I realize I'm sort of over time, is there've been quite a lot of discussions on the need for protocols around sort of adverse events, different reaching respondents. And I would just sort of echo the need that we've seen that in a lot of the secondary analysis of some of the health information programs like Kilkari, that they need often up to 9 retries for OBD programs to reach the poorest. So you may reach, you know, half of your sample by 5 retries, but that half is going to be, even amongst people with access to a phone, the least marginalized. So I think we really have to take care to think about what are the protocols around times of day individuals are called, making sure that, of course, those stay within the TRI regulations of 9 a.m. to 9 p.m., but that we are trying multiple times to reach really, you know, everybody within this target sample that we want. And then the last point, and that is linked with data quality. I was very pleased to see the work that Krishna is doing around using machine learning. I think our group has also done something similar. The protocol paper should be published from that any day now, but we've sought to also use machine learning to identify impediments in the data and feed that back in near real time to improve the quality of the data collection at the point of collection. And I think that's something I hope other groups also think about doing, so that you're not just waiting until you have the final sample of data, but that you're trying to proactively do things during implementation to improve the quality of data. So over to you, Sunita. I apologize, that was far too much babbling, but thank you again, everybody.
Thank you so much. That's a really great synthesis of the discussion. The discussion has been very, very rich. We have over 100 questions that have come up for panel 2, and this is besides probably the 100 questions that I left unanswered for panel 1. I feel like we probably need 5 more webinars to really dig into these issues fully. I want to take one though before we wrap up, and it builds on a couple of the statistics that you shared, Amnesty, around the fact that you had found in Madhya Pradesh that only 38% of women actually have access to a phone during the day, and that their mobile phone literacy was also not particularly high. And
yes,
so
and sorry, Sunita, just to add to that, and SIM churn amongst people with access to a phone after a year was 44%.
Wow. So, you know, I think we're hearing anecdotal reports of reporting to the National Commission on Women, you know, increased reporting of incidents of gender-based violence coming to the National Commission on Women, and this is despite the lockdown. And having worked on gender-based violence for over 15 years, I know that it takes a lot before a woman actually reaches out to an external resource like the NCW for help. And you know, the modality of phone surveys is highly limiting in terms of our ability to ask these really sensitive questions. And Amnesty, I'm with you. Having worked on this issue for many years, I would not ask questions around gender-based violence via the phone. But setting that aside, even just understanding what are women's experiences of COVID-19, a group of civil society groups had done a survey in which they found that women's, labor within the household labor, care labor, had gone up significantly, with the return of migrant members of the household, etc. And so women are experiencing various kinds of challenges. And how can we get, from an ethical standpoint, it does, we feel like we do need to capture women's experiences. We need to provide avenues for women's voices to be amplified. And so I'd like to turn to Shweta, because I know, Shweta, that your team is looking to do a study specifically focused on women. And I wonder if you can share with us a little bit about how you're navigating some of these challenges.
Sure. And if I can be totally honest, the answer is that it's really hard, and we're taking it question by question by question. And so I'll just give a little bit of context, right? I think one of the things that we felt, as we started our work and the crisis hit, the lockdown, came into being in India, was that we knew it was going to be so important to give voices to women, especially during this time, especially because we felt like policies were being gender blind, which is worse than being gender neutral, right? And so we knew that it was critical and critically important. And even in our entitlement study, we saw that, women's response rates was much lower than males' response rate. So it was even hard, frankly, to get to kind of our set quota in terms of how many women we reached. And so now we're in this journey where we're trying to understand, a few topics around women, right? Thinking about, what is the impact on their nutrition and how can government better service that? What is their access to entitlements? What is their impact? What is the impact on women's access to their cash entitlements and their agency over it, etc. And to some extent, we also did want to shine a spotlight on topics like gender-based violence, because as Sunita said, right, the data is both really important, but also really spotty and poor. And so, we've been grappling with these questions literally every day. And I think on some topics, like GBV, even though we haven't come out on an answer on that, we've been exploring how do we not ask the question about the woman directly, but actually about her community, right? And we may still actually end up not asking the GBV question at all. I think that's likely going to be the answer, but it gives you an illustration of how do you start thinking about the topic in a way that is maybe a little bit more sensitive than otherwise would have been. For each of the other modules, again, we kind of we bring that lens of ethnographic research, where we have our team that is really dedicated at looking at what is the experiences of women on the ground and having that deep view, where we have the conversation in the first go, and then informing how does that design our questionnaire. But then, like I said at the very outset, it's literally question by question, and we try to ask the question of, is this an innocuous question? What might be the unintended consequence? Who might be around, when the woman is having the conversation with us? Is it likely that she's going to be around her partner, a mother-in-law, a father-in-law, her children, and therefore might be less comfortable answering the question or might not actually be able to give the right response? And then therefore, what does that mean in terms of changing the question itself? And so the only guidance that I have in this case is to say, think about what the room is going to look like. Think about what the woman might be feeling or experiencing, to the extent that you can kind of get that information from other sources, through ethnographic research, et cetera, please do it. And then take it question by question and say, this is how important is this question? Can I ask it in a simpler and less harmful way? And ultimately at the end, is it worth the potential trade-off that might exist, right? Am I going to be doing more harm than good? Or because of the value of what I'm trying to do and who I'm trying to share it with, is actually the benefit of this particular question going to say it very directly, outweigh some of the potential costs? And so that's how we're grappling with it. I don't have the straightest answers, but I really welcome others' perspectives. And I think the other thing that we're really trying to do is actually make sure that we vet our study with many experts, right? So we're taking it a little bit slower than we are with some of our other studies. So, making sure to reach out to nutrition experts, reach out to folks like you and women, et cetera, to see, what are some of the best practices that other people have done and are using, how are they dealing with these questions, where are standardized questions that others have used, et cetera, so we can draw on the rich experiences from other people, because it's especially important for women, right, who are particularly marginalized. I don't know if that's a fulfilling answer, but it's the most honest answer I can give.
Thank you. I think this is a super complex and challenging area. Arya, I'm wondering if you wanted to comment. I know that you mentioned that you've been in touch with women who had also migrated for work, and I'm wondering if there are any specific insights you have that you'd like to share.
Those are still in the process of us processing it. We just got some of the migrant data, so I don't have a clear answer on that yet. And once I do, I'm really happy to share it out.
Great. I don't know if that was Arya or Shweta. I'm a little confused, but Arya, are you still on the line? Okay. One question I think there was a question to Karima, Karima, I'm wondering if you can talk a little bit about the process of IRB approval and getting approval to do the facility ethnography. Have you gone back to your IRB post-COVID, for example?
No, we haven't gone back to our IRB post-COVID, but the study was part of, having telephone conversations was already built in our original IRB application. So from the very beginning, we were in the field physically, but we were also in contact with the providers at these facilities through other means, including telephone calls, though the emphasis throughout the beginning part, up until COVID started, was of course on being physically present. But we would sometimes have to reach out to them and ask them things on the phone in between being there. The process of getting IRB was, as usual, stringent, but not, unduly so. The main concern, I was the person who went and presented the IRB proposal to the IRB board. here in Delhi. And the panel's main concern was protecting the identity and confidentiality and trust of the providers who we would be interacting with, since we were in so few sites, that there would be no repercussions from them on them, and no blaming, etc., and they would not be penalized for sharing any openly discussing the challenges they're facing in the workplace to deliver services. And once that was agreed with all the partners and the IRB panel was reassured by that, then that was really the only question they had.
Thank you. I think the issue of IRBs is a broad issue. It's a great question, one that I think we can take to all of our panelists offline. Adi, I'm wondering if you would like to comment at all on the issue of women's use of Mobile Vani, and Mobile Vani being a platform through which one can actually hear women's voices directly, and sort of a voluntary way in which
yeah.
Women can...
Yeah. Broadly speaking, definitely wherever we have some of our platforms are entirely women platforms, where basically it's just women who use it and who comment and contribute content. And we've had good responses from there. Experience that we've had that some of these platforms were very vocal, where women would talk about domestic violence, and there was also a lot of action that our volunteers on the ground were facilitating by linking them with the women helpline and also getting some help from the police. But actually during the pandemic, there's been complete silence on these platforms on as far as gender-based violence is concerned. There's been no issues reported, and we can all, of course, understand why, right? That it's the access to the phone is not easy, right? A private access to the phone is not easy. So those are definitely issues. But yeah, by and large, we've had women talking definitely about other issues, right? On finance, on income loss, on food. So all that is definitely there, and yeah, in that sense, I think the broad learning that we've had is that something like Mobile Vani, which was a media platform, that's been very instrumental as an asset that we sustained over the years, and then we could leverage it during these times to get inputs and to give policy feedback.
Fantastic. Thank you so much, Adi. And last 1 minute parting thought from Shruti.
Sorry, Sunita, I lost your voice in the middle. Was there a specific question?
No specific question, but sort of, is there an unanswered question or, issue that you're grappling with still, that you're taking back into the field work that you're doing?
Well, Sunita, I think I would be reiterating a lot of points that have already been raised. Representation is something that we are definitely we are struggling with, and something that we would like to address better within our sample sets. So that is something that we are. Any insights from from the peer group, where we can learn from them is definitely something we take home, and we consider very deeply. The other thing, I think one small thing which we maybe didn't mention during the panel, and I think I'll say that I've realized that especially where multiple projects where you're basically engaging with the same community, and there are multiple projects running, so there's sort of an overexposure of the community, if I could put it like that, in some senses. And since also because we work with enumerators who are very much from the community, so they're not just locally placed, they are from the community. We have to be very careful in the way in which we administer our questionnaires, our surveys, being sensitive both for the community and for our enumerators, because for them there is no way for us to sort of mask their identity, or they're very much part of the community, and they're changing roles with different with different surveys that they maybe assist us with, or even if it's the same survey, for instance, but their continuing presence in the community also sometimes gives our respondents an access to them in which, in a small village, it's easy to find out who, where that person is, or you might even just know them and be able to reach out to them. And
Yeah.
that kind of access also makes it difficult for us surveyors sometimes. So that is also something we try to handle or try to work with during our trainings. And I don't think, this issue wasn't mentioned in any of the other panels. I'm not sure if this is something that we've been seeing, or if it's a common experience across. But we really think that especially in overexposed communities where multiple work is happening, or where your enumerator or your surveyor or your field person is really deeply involved in the community, it's also very important to give them adequate support. And it's a continuous learning process for us to manage expectations on both sides, and to ensure that the surveys also feel just as safe
Right. I think it's
during
not just limited only to phone surveys. And I think when you do community-based research, and you have research, and I experienced this when I was doing research previously, prior to joining the foundation as well. So we are way over time. And I'm going to bring this conversation to a close with some regret, because I think there are so many interesting questions that the panelists have raised, and that our amazing webinar participants, are still almost 200 online, have asked over the course of the last almost 2 hours. There is clearly a lot more for us to learn about how to do phone surveys, particularly in these really difficult, challenging times when the way forward is also relatively unclear. There are really deep ethical questions, issues that we need to keep in mind. I think, again, I take away the importance of acting with empathy and compassion, and the importance of having compassion and empathy, for our teams, particularly the interviewers and data collectors, as well as, of course, for the people whose stories that we're trying to capture and to communicate. I want to thank the National Data Quality Forum for hosting this conversation. We will, I think, be documenting the questions and crowdsourcing answers. I also want to share that very soon we will be launching, or not we, a group of researchers hopefully are looking to come together to develop a network of folks working on COVID and its impacts in India. The Gates Foundation, along with other philanthropies, will be supporting a secretariat that will anchor this COVID research network, and we hope that the network will also become a focal point for sharing lessons learned, for sharing instruments, research instruments. Many people have asked about scripts that are used to obtain informed consent, to respond to respondents who may be expressing distress, etc. So we are hoping to bring a lot of these resources together in one place on the web, and have them actually available, accessible to others. So please look out for the announcement of the launch of that research network and site. We will be using the National Data Quality Forum's website as well to communicate the availability of that resource. So back to Niranjan, and signing off. Have I lost the organizer of the webinar?
Hi. Yeah, thanks so much, Sunita. I'm here. In fact, I was trying to unmute my microphone. So thanks so much for wonderfully leading the discussion, and it's a very encouraging perspectives and the views, and so much of knowledge that we at the National Data Quality Forum and the ICMR and Population Council appreciate the perspectives of the panelists. What we are going to do is the recording of this panel discussion will be available on the NDQF website, which we'll share with all the attendees, which can be further shared with their colleagues who might find it interesting. And at the same time, we'd like to bring out proceedings of this conversation, because there is a whole lot of rich information that each other can learn from the experiences. And thanks once again. And good night, good day to the outside India colleagues, and good night to Indian colleagues. Thanks so much. A big round of applause to Sunita for you.
Yes, the panelists were amazing. So thank you all for the amazing work you're doing. And thank you to the 172 people who are still online. Thank you for engaging with us.
Thank you.
Good night. Good day.
Good night. Bye-bye.